Hi everybody, this is Dr. K from Holistic Minds. I'm so happy to have Dr. Gill and Dr. Sammy here together because the two of you work hand in hand and you work together so often on so many cases. So I'd love for you to share with our audience some of the cases that you've worked on together and how you see the cases come together.
Okay. I was thinking maybe I should describe a little bit about how an osteopathic treatment looks.
Yeah.
That would be great.
Would give us a little bit more information.
That would be great.
Normally, when I see a patient, I do a history and physical, like most physicians, but then I do a comprehensive osteopathic evaluation, and that means putting my hands on the child's body from their feet all the way up to their head and making notes about the things that strike me as being very important, whether it's a bony restriction or an abnormality, or the fact that their liver's turned, or that they're not breathing very well, or that one orbit is, as you mentioned before, one eye socket is higher than the other. So I get an analysis of that pattern, and I've done my history, my physical, and I've looked at whatever other information the parents bring to me. And then we start I actually like to start at their feet. And I sit at their feet with my hands on their feet and track all the way through their body on whatever avenue is given to me. Sometimes it's fascial, sometimes it's a fluid avenue, sometimes it's skeletal. It just depends on the child. And so when I come and work with Dr. Sammy, she's done her evaluation, I do my evaluation, and I treat the child before the child is given the frenectomy.
Or the ALF.
Or the appliance, because I want to get them into their healthiest, most neutral state, so the appliance supports that.
Gotcha. And what is an ALF? I don't think most people know.
Oh, that's a good question.
That's good. So the ALF, it's advanced light wire functional appliance. It's a orthopedic, and I call it osteopathic appliance that it's more inside the mouth, and it does all of there's different kinds of ALF. So it starts basically expanding or bringing the jaw forward, but more with the orientation of the midline and not forcing it. It's very light, so it's not forcing things into place, but with, I call it an invitation. It invites the body to come to its wholeness and wellness and the aspects of that it will really nurture and nourishes the body. So it's more inside the mouth. Usually it has like one, couple of cribs, or there's different kinds of it, but you don't see it most often. It's inside in the palate or inside the bottom of the mouth, or sometimes on the cheek part, if like you're trying to bring the jaw forward. But all of it, it's with an orientation, osteopathic orientation, and a whole body orientation to invite the body to all work together and cohesively.
Can I just make an observation about
Absolutely.
the ALF?
Sure.
One of the things that I find is so powerful about the ALF is that the physical design mimics the healthy tongue.
Right.
So when the tongue is working in health, you get an expansion of the palate in every direction. Whereas most orthodontic devices, if they're going to spread the palate and you've got a narrow palate on the left and a nice wide palate on the right, you're going to get this. You're not going to get that.
Yeah.
And so to me, the ALF is almost embryological because it utilizes an understanding of the same forces of development.
Right.
So that's why it affects the whole body.
Right.
And that's my osteopathic perspective, not being a
No,
dentist.
and actually, like, for example, a typical orthodontic appliance that is, the screw types, the ones that you go and like kind of turn the screw, it doesn't symmetric. It basically it opens the front and it opens the side, but it doesn't open the back.
Oh,
So,
that's interesting.
and then what happens is like the vomer is sitting up there, and there's lots of changes that it's happening in the vomer, and
So
it
it's
doesn't.
affecting the nasal, the
Exactly.
septum of the nasal.
And it's doing it so quickly that it's osteopathically not conducive to the rest of the body. So you can feel and then if there's already asymmetry that is present, then it torques one side much more than the other side, and it actually exacerbates the asymmetry. both in the cranium as well as in the neck. So
it's actually a more limited view of what's necessary for the body,
Right.
the traditional orthodontic devices, whereas the ALF appliance allows you to move one tooth and
Yes.
then affect the whole side of the face.
Right.
Yeah.
And it's that sensitive because
Right.
we have seen cases where you came and said, oh, I feel just a little bit of strain in here, or the sphenoid is like rotating this way, and with me just kind of bending just a tiny bit on one part, like now the whole fluid dynamic is completely different.
I think that's the fun for me, is that I can have my hands on a child's head and feel what's happening with the 22 bones as individual bones, or the whole head, if we're just talking about the head. And you can go in with your finger and say, well, if I move the appliance this way, or if I supported this particular growth, and you show me the pressures that you're utilizing inside the mouth, I can actually feel what's happening in response to that in the
Right.
whole head, and we can have a dialogue about it. Well, that's really terrific because it helps the nose open up, but gee, there's all this tension happening back where the ear and the back of the skull join to one another. And then you slightly adjust the way you would put pressure, so
Yes.
because you're getting into the nuance of what's possible with the appliance,
Right.
and all that rounds out.
Opens up.
Yeah, so we really are communicating back and
Yes.
forth, and I
That's
have no
amazing.
idea how she does that with a wire. I don't know.
And I have no idea how she does that with her magical hand. I want to actually share a personal story of you, because so when I had Hafez, Hafez 12 years ago came out like this, and they weren't able to push the hand down.
Oh, his arm was up by his head, right?
Yeah.
Okay.
So and he actually came out like that, and we kept swaddling, and then the hand would just kind of come up like that, slide up like that. And I didn't know Dr. Gill at that time. My husband knew her, and not personally at that level actually. He's like, oh, let's go to see Dr. Gill, And so the first time that she worked on Hafez, I came back home and I said, what did she do? She didn't do anything, So she just had her hands underneath. And he's like, don't worry, it will all make sense at some point. And I didn't have my osteopathic training at that point, so I had no idea what you're doing. The second time we came in, his hand just came down and it never went up again. And it was such an incredible, like when I just saw that, it was such an incredible, magical thing. Like, how could your hand be just underneath his little body and does do so much, So I asked to see you myself, if you recall. It was a few weeks after the delivery, and it was a difficult delivery. So again, you had your hands under me, and then I came and I said, so she didn't do anything. I didn't even feel any movements inside my body. I got home and I had like the most incredible pain that I've ever had, and I asked my husband, I was like, how could I have so much pain? She didn't even massage me. She didn't even crack me. He goes, well, it gets worse sometimes before it gets better. She moved a lot of things inside your body. And then next morning I woke up and it, like, my body never felt better since I gave birth, which was really, because I hear a lot of people, because they don't see your hands moving or cracking or massaging, they don't quite understand the dynamic of the fluid that you're moving through, or the beautiful work that you're doing with it, from the nerves to the to the arteries, to the veins, to the lymphatics, so many different things, that to moving actually the cranium, where a kid looks different, or the hand comes down and never goes up again. So I just wanted to share this personal story because I became the lover of her work right after Hafez, and my own experiences, as a new mom who didn't understand anything about osteopathic, even though I had a husband who was an osteopath, so, but I didn't really understand the concept of it.
Yeah, I mean, I think it's really, it is hard. You actually brought up this question to me. It's hard for people to conceive that something could be happening when hands aren't moving.
Yeah.
So I'm going to take a totally separate example and tell you that a while back, somebody did an experiment with a pattern generating machine. It's not a human being, it's a machine. And they looked at this concept that thoughts are things. A thought has an effect on us. You think something negative about somebody, even if your face isn't saying it, they're going to feel that in some way. All right. So they took this random generating machine that either shows you pears or apples, and it'll show 3 pears and then 2 apples and then 1 pear, and that's what it does. And they had a group of people think about the machine only showing pears. It completely changed the randomness, and many more pears were shown. So why is that? We are electromagnetic. There's lots of proof for that. An action potential for me to reach my arm out to you is an electric event from my brain to my hand muscles. So there is an effect of what the mind is able to conceive of and what actually happens in the patient. So yeah, we can work with fascia, we can work with bones, we can bend things and pull things and pop and crunch joints and things like that. But there's actually a bigger container that we exist within. And as you evolve in your understanding of pediatrics and dentistry and osteopathy, you realize that you have to get much more global with what you're going to work with to help the patient. So just because my hands are on somebody's back and their tailbone does not mean that that's what I'm thinking about, or that's the information that's coming into my hands. An acupuncturist can put their hand on the radial pulse in the arm, and they can feel 15 different things.
Yeah.
I feel the radial pulse. I might feel the blood flow in the radial artery, but I don't know what their training is.
Yeah.
If you're going to play the violin, where are the struts? Where are the notes? You have to be trained to feel them and find them. And when you get exactly that note and you play it, it's beautiful. If you're off, it sounds horrible. It's the same thing in the human body.
Oh, I think I have 2 examples. One is my own, kind of like the experience you had. There was one time when my neck and back were so off from all the work and everything else, where literally I was like stuck. I don't know if you remember this. This was probably about a year ago. And then one treatment later, like everything is starting to move. Literally, I was at my friend's wedding, and to like see people, I had to turn my entire body because everything was so locked up, which is kind of a shameful thing for a non-student to admit about themselves. But I was a hot mess, and literally 1 session later, he got everything to just dial in, and it was the same thing. I mean, there was light touch.
Yeah.
But what's also been fun is cases that we've shared together where, like, I remember one vividly where it was this guy, he had this big lymphatic drainage or malformation, huge mass. This was years ago. And then as you were, feeling him, you turned to me like, you know what, this was a midline defect that he had in an embryo. And I was like, how in God's good earth did you feel that? And one of the fun things that happened with that is because methylation errors are all ultimately resulting in midline errors. One of the other issues, actually a bigger issue that this guy had, was severe insomnia. This was the 3-year-old that was like, he would be up all night, every night, would sleep 2 hours. The rest of the time would just be bouncing up and down and would drive everyone crazy. So I actually, based on what you said, gave them B12 injections and big amounts of folates, and 2 days later he started sleeping for the first time in his life. And it was because of what you had felt in this kid that had to go back to what was going on when he was conceived, that had me say, well, if that's going on, this is probably going on, which is causing something totally unrelated, but it actually transformed this family's life.
I remember that. That was really fun.
Yeah.
It was fun when the structure of the embryo informed your biochemical approach, and then you totally changed it. It was really fun that they both pointed to the same problem.
Yeah, even though they seem
coming from
unrelated.
2 totally different arenas.
Yeah.
That's very cool. Very cool.
Is there a share that, or a case that the 2 of you want to share about maybe a patient that you've had that ultimately had some kind of tongue tie or oral restriction of whatever sort, and ultimately resulted in some kind of behavioral change? Or
Yeah, maybe we can talk about. So one of the things that I learned from Dr. Gill, working with Dr. Gill, is when you go through a frenectomy, training, most often than not, they kind of ask you to make this like perfect diamond shape, and yes, you cut here and you cut there and you release here, whether it's with a scissor, which sometimes it doesn't release enough, or with a laser, or however you're doing it. So some of the cases we actually, with the common patient, Dr. Gill comes over here and we do them together. And so we had one little girl that was having a lot of challenges and was going through a lot of different things, the colickiness, the sleeping issues, breastfeeding issues. There were so many things going on, and we were, and also like the body, the strain, and it was constantly being pulled to one side. So you could literally see like the face on one side, it was a little bit less developed than the other side. The eye was a little less developed, the neck had some issues. And so when we were doing the frenectomy with Dr. Gill, kind of like, I said, do you feel that? How about if I just release a little bit less tension on the side that it's actually pulling, and then leave more on the other side. So we actually bring the whole midline back into the whole body back into the midline. Let's see what happens if you do that with the tongue. So she's feeling it, she's treating the kid, and that's what we did. We kind of did a completely asymmetric, release, and it was amazing. Like the whole body just shifted to the midline, and the structure and everything just started like feeling different, the fluid dynamics, everything. And then so many years later, where we have kind of kept, she's still our patient, she has developed very symmetrically. So much of her face has, she's developing also like psychologically in a very different direction that she was going.
She's not fearful anymore.
Yeah,
she really grabs life.
Yeah, or angry.
Yeah.
She was very angry. That was my experience
Mm-hmm.
of her. Even as a baby, she was very angry. So. It's a completely different direction. So quite often, when she's here, we do also with some of the more difficult cases, I do some release, and then she works on the patient in the room and releases a little bit more, and then I like do almost like one fiber at one fiber. How does this feel?
Wow.
How does that feel? How does that feel? Like, oh yeah, that actually, or I pull on one thing. It's like, if I release this, what happens? And it's really incredible, like what happens in the whole body.
They start breathing differently.
Yeah.
Their eyes relax. I mean, you can see that it's not just the tongue that we're
Yes.
trying to nuance.
Yeah.
To me, it's some developmental arrest happened early on in the embryo, and it affected the formation of the tongue, the nerves that go to the tongue, the whole cranial base. It affected a number of different things, and maybe it is going to turn out to be, something to do with MTHFR. I don't really know. You're still searching for that. I know you're going to figure it out.
Yeah.
But it's a global pattern, and we're seeing the tail of the elephant, which is this tongue tie. And so, all of us are trying to work together to figure out a way, how do we get a positive global release and improvement, so that this child, their nervous system can work better, they're swallowing, they're breathing, and they can move into their life successfully. I mean, that's the whole point, and the collaboration is very powerful.
I often actually we see that, so most babies, they don't like the glasses, the laser glasses. So we put the glasses on them and they kind of start crying, and then a lot of times we do the release, they take this like, and then they stop crying, almost like the whole entire body goes to like a very, very tiny shake, and then just all opens up. When you were talking about the face, I remember that baby that came from England, that literally like the eyes were really pulled down. We have to show you the picture, and like everything was just, the whole face was pulled down, and we released the upper, and all of a sudden like it just like the baby,
face,
like her whole
Wow.
face actually
Yeah.
literally changed in front of our eyes,
Yeah.
subtle but really profound. Like the eyes actually went up, so it's a lot of times we're seeing that shift in not just, the tongue and the lip and, or even like now we are doing a lot of discovery with the buccal ties, unilateral buccal ties a lot of times.
So the cheeks are super tight because they're
Yes.
tied down to the gums.
Yeah, and then it's also pulling down. So that collaborations and that feedback that I get from Dr. Gill, and Dr. Gill get actually like, oh, do this and let's see what happens, or we kind of go through that. I don't know, I don't think that you should do a frenectomy without osteopathic feeling, at least, because it's so much more than just releasing the tongue and releasing the tie. It's much more about the whole thing. As well as the same thing with patients that they have any kind of asymmetry in orthodontics. I feel like if you can't really feel the kid, we had one patient that it was, I don't know if you remember this was when I was in Brentwood. So I would take an impression of her. She would go to Dr. Gill, get treated. She would come back and the appliance wouldn't fit, And then again, like I would take another, it was like almost like it was like a different mouth. And then she would again, like next time she would take another impression. I'm so sorry, the lab must have messed it up, She would go to Dr. Gill, get a treatment, come back, and again, the appliance wouldn't fit. We did that 4 times before it dawned on me, like, do you both see Dr. Gill between the visits? Oh yeah, we were very good about like right after here we go over there, And then we figured out, I'm like, please don't. Between the time I take the impression until the time that I'm delivering the appliance, don't go. Do that before you come over here. And then that way the body is ready for the impression and it's like all in alignment. And then we'll make the impression in the optimal position. And then we'll deliver the appliance and then go talk to Dr. Gill, because then she can also give you some feedback about how to adjust the cranium where, or the appliance where it would be like also helping her with the rest of the body and getting that optimal result.
I want to think of I just thought of one more thing. Several of the children you sent to me who had problems with attention deficit disorder when they were older, 8, 9-year-old children, they had very narrowed and overlapping forehead bones, which is very restrictive for parts of the brain, especially the orbitofrontal area of the brain, which is right behind the eye. And that part of the brain helps us calm down our reaction to the fight or flight messages. It's also really important for planning, motor planning, some aspects of memory, etc. So, and also just behind that is the hippocampus that makes brand new nerve cells and the amygdala where emotions are. So it's a really compact place. And I remember seeing this newborn with Dr. Sammy, who literally had overlapping forehead bones.
Their head is just kind of.
It's just so
squished
narrow. They're really squished in the forehead. It just looks very odd. And this child had a significant upper lip tie where they just, they literally could not. You couldn't see the pink of their lip at all.
Wow.
And she did the release, and that was when I realized, that was the moment that I realized, that whatever attaches the lip to the gums embryologically tracks all the way up through the septum between the nose. It goes up through behind the eyes to the membranes that form the soft spot.
Wow.
And this baby also had a tiny, tiny little soft spot. So something that your parents could really look for is the rule of thumb. If you can put this pad of your thumb into the baby's anterior fontanelle or their soft spot, and that's all that fits, you might want to have your child looked at by somebody who does osteopathy, because that means that the forehead bones are overlapping, and so are the parietal bones, and so they have a small soft spot, and we want to give them space for that soft spot so that their whole brain has room to grow. Anyway, so the overlapping forehead bones really prevent some of the forward development and unfolding of the brain, and they have a mechanical effect on kids who have difficulty concentrating. Not everybody has this, but there's a tie-in between those children that you sent me and when we worked on that baby together.
I think it's also really useful for parents to actually put their fingers in the child's mouth and kind of go over the palate.
Mhm.
You know, the palate needs to be wide and very shallow, and basically like one kind of a smooth round ways. When there's like a step, you know, almost like you can actually take a picture of it now with our iPhones. You can take a picture of the palate, and when there's a step, you can literally see where the tongue sits and dysfunctions. And then that palate is, you know, part of the sinus, and then it actually like the orbits, you know, so it really creates so many other aspects because the molar sits on it. So it creates, and then the sphenoid starts kind of turning. So looking at, and some of the babies, we see that they have very narrow palate, and we do actually infant ALFs.
Wow.
So before they have teeth, so between, you know, 1 month to 5 months, 6 months, something like that, is super, super effective. We have the patient that he's so good about wearing it that, you know, his jaw came forward, his upper palate really, because they just chew on it, you know. So
They like
and it's
it.
yeah, they love it, and basically we take an impression of their you know, of them, and then send it, and then, you know, deliver it for them, and then just kind of, you know, monitor it, like as the teeth come in, we release some. So
Wow.
but some of those things, it makes such a huge difference in like opening things up, where maybe in utero it got really jammed in.
So, and the questions that get asked, you know, when you come back and say, gee, do you think, you know, it's something in the brainstem, or do you think you should pay attention to the thalamus, or have you thought about this? Then I can go back and specifically look at something that I wouldn't otherwise, you know, focus on, because I'm focusing on a bunch of other things. I do think that the questions that come in your mind, and the same for you, lead me to look differently at the child, and sometimes it really provides the answer.
Wow.
You know, a photograph or an idea, or your comment about the midline. And the reason we harp on the midline is that is the organizational function and structure for everything. Your oxygen, your biochemistry, your arms, your face, your tongue, everything orients to that original midline, which in the embryo, you know, helps guide the formation of the notochord and the whole neural tube and the brain development and everything that keys off of that. That's why we keep going back to it, put them on the midline. That's a big concept for us.
And I think like a lot of parents, they think midline is just like the parts like straight right down the body. It's not that, you know, it's
a function.
It's a function. When all of the things that we do, we just keep emphasizing midline, because once you come to the midline, then the body just kind of takes off on its own in the healing pathways, you know, rather than dysfunction.
It's the integrative function in the body since conception, pretty much.
Yeah. It's where we were talking about with someone, and he said that it's where the light enters, and I love that concept too. So,
Yes.
That's, okay, geez, I don't even know what to say.
What? We ran out of something to say?
No, it's just that, I mean, the things that the both of you do, the contributions the both of you make to your patients, and I think to our community as a whole, is really incredible.
Thank you.
And you're welcome.
Thanks so much for doing this.
Yeah.
Oh, my pleasure. I feel it's my duty to be doing this, and you know, hopefully we can get people from around the world to be able to get access to this information and to change the lives of hundreds of thousands of families everywhere.
That would be a blessing.
But I think it's happening. You know,
Yes.
I know in my profession, like 10, 12 years ago when I was doing these kind of things, it was just so frowned upon, and nobody understood it, and everybody was, you know, kind of like, what is frenectomy? That's all, you know, that's all hokey pokey. And then now there's like mini residency at Tufts University that goes through airway and frenectomy. And so and the other day actually I was in one of the very few orthodontic lectures that I go, and she's like, well, since airways are so, you know, hip now, so we're starting to look at Airway, so I better talk about Airways, So it was
Now that breathing is actually considered important, I guess I have to talk about someone breathing.
someone breathing rather than like beautiful teeth. But I feel like we're already moving that way. There's so many more people that they are understanding osteopathy and craniosacral than I would even say 10 years ago. There's a lot more people that when they come to me and they ask about the frenum because they're lactation consultant or they're their osteopath or their pediatrician, I feel like that education is becoming more and more, like with works like, Dr. Zoggy's work and some of these things is becoming so much more accessible that it's no longer the outlier where they have to like travel. I mean, I have people that they come from Australia and England and, to see me and do the frenectomies or doing the ALF, but I feel like it's becoming so much more understood that there are more and more practitioners that they're being trained that your vision it's actually going to be fulfilled pretty soon in terms of people finding practitioners near them to do these kind of things. So it's not just like, okay, what am I going to do with this information? Now I have no access to anyone. I felt like there's more practitioners that they're like, what were you saying? What did you learn? And then they're going and seeking the education in order to have them grow as a practitioner.
It's true. Actually, one of our colleagues has a residency that she's offering, and she's training dentists on the East Coast along with another dentist.
Right.
And they're starting to collect a number of people. So it's happening. It's
Good.
happening in different places.
We need it.
Yes.
It's so needed.
Absolutely.
Well,
Absolutely.
Thank you both.
Thank you.
And thank you all for listening.
Thank you.
This is Dr. K from Holistic Minds, and Dr. Gill and Dr. Samuel.